Typhoon Odette hit the country more than a month ago, but thousands are still in need of aid to get back on their feet. Medical humanitarian organization Doctors Without Borders recently visited the typhoon-hit areas of Dinagat Islands and Surigao del Norte, and one of its emergency medical coordinators, Dr. Chenery Ann Lim, joins us now. Hi, Dr. Lim. Good morning, and thank you for joining us. Now, we've seen the extent of the damage, obviously, on pictures and videos. You've actually seen it, you and your team have seen it on the ground. What is the extent of the typhoon's damage that you guys have seen in these two areas?
So basically, when you're here, the extent of the damage is really very massive. You cannot imagine how massive it is. It's not like we just lost properties from the people, but also in health infrastructures, for example, basic services that they actually go to. Even evacuation center that was identified for them are actually also damaged. So the extent is really very, very massive.
Right, Doctor, we know that aid has been pouring in for the residents over the past month, but I'm sure much more still needs to be done. At this point, what are the most urgent needs of the locals?
I think one of the things that people need to understand is that geographically, some areas here in Dinagat as well as in Surigao del Norte are very, very difficult to access. So there are still a lot of areas that hasn't been reached. So definitely any kinds of support and any kinds of help is really very welcome. I think one of the major difficulties that we're also having in responding is also the difficulty in access, because the weather here is also not cooperating because it's been raining quite a lot. There was just this low pressure area that just passed through. So yes, there are some also delays in some of the assistance. However, any support and any help that anybody can give is still very, very much welcome. Because as you said, the needs are very massive.
Okay, we'll talk about that support and those particular needs, but I think that's something that we need to underline is, help has continuously poured in, and many people have actually contributed themselves and feel like perhaps the work has been done and is finished, but many of these areas, as you pointed out, are quite difficult to reach, and it takes some time for assistance and help to actually reach some of these far-flung areas and hard-to-reach areas. Can you help us understand, how does Doctors Without Borders help in providing these needs? Is it purely medical needs, or do you also assist in other non-medical ways?
Yeah, so for us, what we are actually doing is helping a bit of what we call a holistic approach. So what we do is also, aside from medical needs, we also do preventative aspect, wherein when we distribute, for example, non-food items, like for example, hygiene kits, is to ensure also that there will be preventing the emerging diseases, like for example, like diarrhea, so that so we provide, for example, jerry cans or water storage with aqua tubs that help clean the water, for example, soaps, for example. So just these basic things, so that we can also prevent emerging diseases from coming out because of what happened to the people in the affected areas.
All
So
right, Doctor,
aside from
I'm
this,
sure people
we're
want
also
to...
supporting, for example. Yeah.
Please, go on.
Sorry, go ahead.
Well,
Yeah,
I was just
so
going to add
I
that
was
I'm
just
sure
saying that
people
we're
want
also
to
supporting.
extend a little bit of assistance. How can they help? Do you need more boots on the ground? Do you need actual physical assistance for people to come in and actually physically help? Or are there other ways or more effective ways that people can be lending a hand?
As I said, so for us, we always need help all the time. So there, if you can do financial assistance or material assistance or human resource assistance, you can always visit our website at www.doctorswithoutborders-apac.org.
All right, there you go. The work does continue, and we salute your efforts. Thank you so much for joining us this morning. That was Dr. Chen Lim from Doctors Without Borders.